This program is brought to you by the Rollins School of Public Health of Emory University.
The World Health Organization defines health as a state of complete physical, mental, and social well-being. In other words, there is no health without mental health. From a population perspective, mental illness represents an enormous burden, both in the United States and globally. Approximately 25% of all adults have a mental illness, and about 50% will develop at least one mental illness during their lifetime. And according to the landmark Global Burden of Disease study, mental illnesses account for over 15% of the burden of disease in established market economies, such as the United States. Only cardiovascular disease accounts for a greater burden of disease around the world. Relative to this enormous burden, mental health has historically been neglected. 40% of countries, including the United States, do not have an explicit mental health policy, and more than a third of countries allocate less than 1% of their public health budgets to mental health. Globally, 2/3 of people with a mental disorder receive no treatment at all. World Mental Health Day raises public awareness about mental health issues. The day promotes open discussion of mental disorders and investments in mental health treatment services. I've always been committed to using a public health framework to improve mental health, and at the same time, making sure that mental health is included in broader public health research and practice. Much of my work centers on taking a population-based approach to improve integration between mental health and general health care, particularly in public safety net systems. Most people with common mental disorders, such as depression and anxiety, never visit a specialty mental health provider, such as a psychologist or psychiatrist, but rather are seen only by primary care providers. Organized team-based models allow for effective detection and management of these common disorders in general medical settings where patients are treated. At the same time, patients with more serious disorders, such as schizophrenia, are commonly seen only by specialty providers, placing them at risk for poor quality of general medical care. These patients die on average 25 years earlier than the general population, mostly due to medical problems, such as cardiovascular diseases. Our team has been working to develop and test models of care to help improve physical health and medical care in people with serious mental illnesses and reduce this disparity in health and mortality. To help promote public health approaches to improving mental health, the Rollins School has developed the first interdisciplinary mental health certificate program in the country. The Mental Health Certificate Program provides a home for students and faculty who want to use a public health framework to improve mental health. The program draws on the unique strengths of the Atlanta community, including the resources of Emory University, the Carter Center Mental Health Program, and the Centers for Disease Control. Students participating in the program focus their studies around classes and practicum experiences related to mental health and public health. The cornerstone of the certificate program is a monthly seminar that brings together national leaders to discuss current topics related to mental health and public health. Topic areas include mental health policy, mental health epidemiology and surveillance, clinical care, and global mental health. Since the program began in 2006, we have had top scientists, thought leaders, and clinical experts speak as part of this lecture series. Students graduating from the program have taken positions in university research, state, federal, and international positions addressing public mental health. In the coming years, we look forward to continuing to nurture this program and to make the Rollins School of Public Health a leader in developing knowledge, promoting public health approaches to improving mental health. If you are interested in learning more about the program, please look for us on the Rollins School of Public Health website at sph.emory.edu.
The preceding program is copyrighted by the Rollins School of Public Health of Emory University.